think about this for a second. How often do we really properly talk about sex when it doesn't go as planned?
Okay.
It feels like something so many people experience, but it's often just silence or misunderstanding.
Yeah, absolutely. There's still a lot of stigma, unfortunately.
That's exactly what we're diving into today. We want to unpack sexual dysfunction, what it actually is, who it affects, and, it's probably more of us than you think.
Definitely.
And then look at the reasons why it happens, which can be surprising, and crucially, what can actually be done about it.
Right.
So whether you're just curious or maybe going through something yourself, or perhaps you want to support someone, you're in the right place. Because, let's face it, sexual health is a really big part of overall well-being.
It really is a vital part. So maybe let's start with the basics. What is sexual dysfunction?
Good idea. Lay it out for us.
Okay. So at its core, sexual dysfunction means having persistent or recurrent problems during any part of what we call the sexual response cycle.
Okay, the response cycle.
Yeah.
Break that down a bit.
Sure. Think of it in roughly 4 stages.
Mm-hmm.
First, there's desire, that initial spark or interest. Then comes arousal, which is how the body gets ready. Heart rate increases, lubrication might occur.
Mm-hmm.
Third is orgasm, the peak. And finally, resolution, when the body returns to its normal state.
Got it. Desire, arousal, orgasm, resolution.
Exactly. So when someone consistently runs into trouble in one or more of those phases, and it prevents them from feeling satisfied sexually, that's generally what we mean by sexual dysfunction.
Right. Consistently being the key word there, not just an off night.
Precisely. And it's really important to understand this as a medical condition. It's not some kind of personal failing or, a sign you're not attracted to your partner.
That's a crucial distinction. So sexual dysfunction sounds like a broad term. What are the specific types of issues that fall under this umbrella?
It is broad, yeah. It covers several distinct categories. For people with a penis, probably the most well-known is erectile dysfunction, or ED. This is basically the persistent inability to get an erection or keep one.
Yeah.
It's firm enough for satisfying sex.
And is it mostly an age thing?
Well, it does become more common with age.
Yeah.
The stats show a definite increase, say, after 40. But, and this is important, it affects men of all ages, younger men too.
Okay.
An occasional issue, maybe from stress or tiredness, that's pretty normal. But if it's happening regularly, consistently, that's ED. The signs are usually difficulty getting hard, trouble staying hard, and sometimes reduced desire can be part of the picture too.
Makes sense. What else affects people with a penis?
Another really common one is premature ejaculation, or PE. This is essentially when ejaculation happens sooner than the person or their partner wants it to, often before or very shortly after penetration.
And is there like a specific time limit on that, like under a minute or?
It's less about the stopwatch and more about satisfaction and control. There isn't a strict time definition because expectations vary so much.
Oh, okay.
The key is whether the rapid ejaculation consistently causes distress or frustration for one or both partners. If it does, then it's considered PE.
And you said that's really common.
It is, actually. It's one of the most prevalent forms of male sexual dysfunction, way more common than people tend to think.
Yeah.
So again, if someone's experiencing this, they're definitely not alone.
Good to know. Now, flipping over to individuals with a vulva, you mentioned the term is broader there, female sexual dysfunction, or FSD.
That's right. FSD is used as more of an umbrella term because it covers a whole spectrum of challenges. It's not just one issue. It can involve problems with desire, arousal, orgasm, or pain.
Okay, so multiple categories within FSD.
Exactly. First, you have sexual desire disorders. This isn't just, not being in the mood sometimes. It's a persistent, recurrent lack of interest in sex. Or maybe significantly reduced sex drive to the point where it causes distress.
More than just a temporary dip.
Definitely. Then there are sexual arousal disorders. This is where someone might want to be intimate, they have the desire, but they have difficulty becoming physically aroused or staying aroused, maybe trouble with lubrication, for example.
Okay.
We also see orgasmic disorders. This is a persistent difficulty in reaching orgasm, even with plenty of stimulation and desire. It can range from orgasms happening only sometimes to never experiencing one.
Wow. Okay. And the last one you mentioned was pain.
Yes, sexual pain disorders. This often involves pain during intercourse, which is called dyspareunia, but it can also be pain during other types of sexual stimulation. The pain might feel superficial, right at the entrance, or it could be deeper inside. Either way, it can obviously really interfere with enjoyment and intimacy.
And just to circle back quickly, low libido, that feeling of low sex drive, that can affect anyone, right? Not just one group.
Absolutely. Low libido can affect anyone, regardless of gender or anatomy.
Yeah.
It's that persistent lack of interest that causes personal distress. And again, we need to distinguish it from the normal ebbs and flows everyone experiences. The causes can be physical, psychological, hormonal, the whole mix.
And painful intercourse, dyspareunia, is that primarily an issue for those with a vulva, or can it affect others too?
It's a very common concern for those with the vulva, but yes, others can experience pain during sex too for various reasons. It might feel sharp or like a deep ache. The causes are varied too. It could be physical things like infections, skin conditions, maybe anatomical issues or psychological factors like anxiety or past trauma.
Right.
Whatever the cause or whoever it affects, it can really put a strain on intimacy and just general well-being. Understanding these different types is kind of the first step, Recognizing what might be happening allows you to start thinking about the underlying causes.
Okay, that gives us a much clearer map of the different ways sexual dysfunction can show up. So let's dig into those underlying causes. What's actually driving these issues?
Well, the thing is, it's usually not straightforward.
Yeah.
It's often a complex interplay between physical factors, psychological ones, and even lifestyle choices. They all kind of mesh together.
Makes sense. Let's start with the physical side. What sort of medical conditions can contribute?
Quite a few, actually. Diabetes is a big one. It can damage nerves and blood vessels, which are, absolutely essential for sexual response. So that can lead to ED, arousal problems, things like that.
Okay.
Heart disease and high blood pressure are also common culprits because they affect blood flow. Good blood flow is critical for erections and also for arousal in general.
Right.
Then you've got things like prostate issues, BPH, or treatments for prostate cancer. Hormonal imbalances are significant too, like low testosterone in those with a penis, or low estrogen, especially around menopause, affecting desire and physical responses. And neurological disorders, think MS, Parkinson's, they can disrupt the nerve signals between the brain and the sexual organs. It just shows how connected everything is in the body.
Yeah, it really does. And it's not just diseases, right? You hear about medications sometimes causing problems too.
Oh, definitely. That's a really important point. A lot of very common medications can unfortunately have sexual side effects.
Like what kind of meds?
Well, certain antidepressants, especially the SSRIs and SNRIs, are pretty well known for sometimes causing decreased libido, difficulty with orgasm, or even ED. Also, some antihistamines, certain blood pressure drugs like beta blockers, and even some anti-seizure medications have been linked to sexual side effects.
So if you notice a change after starting a new drug...
Talk to your doctor, absolutely. Don't just stop taking it, obviously, but have that conversation. They might be able to adjust the dose or suggest an alternative.
Good advice. What about things like alcohol or drugs?
Yeah, substance use can definitely play a role. Too much alcohol, as many people know, can temporarily make it harder to get an erection and can lower desire.
Brewer's droop, as they sometimes call it.
Right. And recreational drugs, things like cocaine, marijuana, opioids, they have really complex effects, often negative, on libido, arousal, and orgasm. And even tobacco use, smoking, contributes to ED over time by damaging blood vessels and restricting blood flow.
Wow. Okay, so lots on the physical side. What about the psychological factors? Stress seems like an obvious one.
Absolutely huge. Our mental and emotional state is deeply, deeply tied to our sexual health. High levels of stress, chronic anxiety, they can really interfere with desire and arousal.
How does that work physiologically?
Well, when you're stressed, your body pumps out stress hormones like cortisol, and these can actually inhibit the physical processes needed for sexual response. It's like your body's in fight or flight mode, not rest and digest, or rest and connect, you could say.
Right, and performance anxiety, that fear of not being good enough?
That's a big one, too. It creates this awful negative feedback loop. You worry about performing, which makes you anxious, which then makes it harder to perform, which increases the anxiety for next time.
Ugh, sounds tough.
It really can be. Depression is another major psychological factor. It often brings a loss of interest in activities that used to be pleasurable, and sex is often one of them. Plus, the fatigue and feelings of hopelessness associated with depression don't exactly help libido or function.
Yeah, the brain-body connection is so powerful there.
It truly is. And we can't forget relationship issues.
Yes. How does that fit in?
Well, if communication is poor, if there's a lack of emotional intimacy, unresolved conflicts, resentment, all of that can spill over into the bedroom and significantly impact sexual well-being and function.
Makes total sense.
And sometimes past trauma, particularly sexual trauma, can have really long-lasting effects. It can create difficulties with arousal, feeling safe during intimacy, or experiencing pleasure. It's complex and often requires specific support.
It really is a complex web. And then layered on top of all that, you mentioned lifestyle factors.
Exactly. Our everyday habits matter too. Things like obesity can contribute. It affects hormone levels, like lowering testosterone, and increases the risk for those conditions we mentioned earlier, like diabetes and heart disease.
Right, which then circle back to impact sexual function.
Precisely. Lack of regular exercise isn't great either. Exercise helps blood flow, boosts energy, manages stress. All good things for sexual health. Conversely, being sedentary can negatively affect all of that.
Diet, sleep.
Yep. A poor diet might mean you're missing nutrients important for hormone production or energy, and sleep is crucial. Sleep disorders can mess with hormone levels, increase stress, cause fatigue, all of which can dampen libido and performance.
It really highlights how sexual health isn't separate, is it? It's part of overall health.
Absolutely. You can't really untangle them. Understanding all these potential contributors, physical, psychological, relational, lifestyle, is key to figuring out the best way forward.
So given all these potential causes and types, it sounds like this must affect a lot of people. How common is sexual dysfunction, really?
It's far, far more common than most people think. Seriously. Study after study shows that a really significant percentage of adults, both men and women, experience some form of sexual dysfunction at some point in their lives.
So it's not some rare condition.
Not at all. The exact numbers can vary a bit depending on how it's defined and who is being studied, but the overall picture is clear. This is a widespread health issue.
Like with ED, we talked about age, but it's not only older men.
Correct. While the likelihood increases with age, partly due to other health conditions becoming more common, younger men experience ED too. Often it might be linked more to psychological factors like anxiety or maybe an undiagnosed health issue.
And for FSD.
Similarly, the various forms of female sexual dysfunction are quite prevalent across different age groups. Issues with desire, arousal, orgasm, pain, these are common complaints.
So the main message here is,
If you are experiencing difficulties, please know you are absolutely not alone. It's incredibly common. It's often hidden behind closed doors because it feels embarrassing or difficult to talk about.
that's really important to hear. Are there particular groups who might be more likely to experience these issues?
Yes, certain factors do increase the risk. Older adults generally are more susceptible. This is due to natural physiological changes, like hormonal shifts, falling testosterone or estrogen levels, and also because they're more likely to have some of those chronic medical conditions we discussed.
That's diabetes or heart disease.
Exactly. So individuals managing those conditions, diabetes, heart disease, high blood pressure, neurological disorders, are definitely at higher risk because of the direct impact on blood flow, nerves, or hormones.
Okay. Any others?
People going through really stressful life events, job loss, bereavement, major relationship, changes the mental and emotional toll can easily translate into sexual difficulties.
Stress again.
Yep. And there's a very strong link with mental health conditions. People with depression, anxiety disorders, PTSD, they have a significantly higher likelihood of experiencing sexual dysfunction. Sometimes it's the condition itself, sometimes it's a side effect of the medication used to treat it.
It seems like knowing these risk factors could help people be more aware, maybe more proactive.
I think so. If you know you fall into a higher risk group, maybe you would pay closer attention, or you feel more empowered to bring up concerns with your doctor sooner rather than later.
Right. Okay, so we've established it's common, we know the different forms it can take, and we have a good handle on the complex causes. Let's talk solutions. What can actually be done? Is it treatable?
Yes, that's the most important message, really. For the vast majority of people, sexual dysfunction is treatable. Effective options are available.
That's really encouraging. So seeking help is worthwhile.
Absolutely. It's a sign of strength, not weakness. The best treatment really depends on the individual, the specific type of dysfunction, and what's causing it. Often it's a combination approach.
Okay, let's break down the options. What about medical treatments?
All right. On the medical side, for ED, the most common treatments are the PDE5 inhibitor medications. These are drugs like sildenafil, brand name, Viagra, tadalafil, or Cialis, and vardenafil, Levitra.
How do they work?
They basically work by improving blood flow to the penis, making it easier to get and maintain an erection when aroused. It's important to note they don't create arousal on their own.
Gotcha. And people need to talk to a doctor about those, right? Side effects and all that?
Oh, absolutely. They aren't suitable for everyone, especially people with certain heart conditions or those taking nitrate medications. So a proper medical evaluation is essential.
Okay. What about for PE, premature ejaculation?
For PE, sometimes certain antidepressants, specifically SSRIs, are prescribed off-label because a common side effect is delayed ejaculation. There are also topical creams with anesthetic agents that can help reduce sensitivity.
Interesting. And for FSD, female sexual dysfunction.
That's often more varied because the issues themselves are more varied. If low desire is linked to menopause, estrogen therapy might help. In some specific cases of low desire, testosterone therapy might be considered, though that's more complex. There are also a couple of medications approved specifically for hypoactive sexual desire disorder, or HSDD, in premenopausal women, flibanserin, Adi, and bremelanotide, Vyleesi. But again, their effectiveness varies, and discussing risks and benefits with a doctor is crucial.
You mentioned hormones earlier as a cause, so hormone therapy can be a direct treatment too.
Yes, if testing reveals a clear hormonal imbalance that's contributing. Testosterone replacement therapy, or TRT, for low testosterone in men can be very effective for improving libido and sometimes erectile function. And as I mentioned, estrogen therapy can help with vaginal dryness, pain, and sometimes desire related to menopause.
Are there surgical options too?
Sometimes. For severe ED where other treatments have failed, penile implants are an option. They have high satisfaction rates, actually. And for specific physical causes of pain during intercourse, like certain anatomical issues, surgery might sometimes be considered.
Okay, so quite a few medical avenues. What about tackling the psychological side, which we know is often a huge piece of the puzzle?
Hugely important. Psychological therapies can be incredibly effective. Cognitive behavioral therapy, or CBT, is often used.
How does CBT help with sexual issues?
It helps people identify and challenge negative thought patterns like that performance anxiety cycle we talked about, and change behaviors that might be contributing to the problem. It builds confidence and focuses on overall well-being, which impacts sexual function.
Makes sense. And sex therapy, specifically?
Yes, sex therapy is a specialized type of talk therapy focusing directly on sexual concerns. A trained sex therapist provides education, helps couples improve communication about sex, and can teach specific techniques or exercises like sensate focus to rebuild intimacy and address particular problems like low desire or erectile difficulties.
And if relationship problems are a big factor?
Then couples therapy is often recommended. It provides a safe space for partners to talk openly about their issues, improve communication overall, address underlying conflicts, and work together on rebuilding intimacy, sexual and emotional.
It really sounds like tackling this often requires looking at the whole picture, body, mind, and relationship.
Absolutely. And that includes lifestyle changes too. Those often support the other treatments.
Right, like diet and exercise.
Exactly. Eating a balanced, healthy diet supports everything: hormone production, blood flow, energy levels. Regular exercise is fantastic for cardiovascular health, which is key for blood flow. Plus, it reduces stress and can boost libido.
Stress management seems crucial too.
Definitely. Finding healthy ways to manage stress, whether it's meditation, yoga, deep breathing, hobbies, spending time in nature, can make a real difference.
And cutting back on.
Limiting alcohol and stopping smoking. Both have clear benefits for blood flow and overall health, which translates directly to better sexual function in many cases.
So it really seems the best approach is tailored, often combining different strategies.
That's usually the case. The most effective plan considers the individual's specific situation, the type of dysfunction, the underlying causes. It's rarely a one-size-fits-all solution.
This has been incredibly helpful, really shedding light on a topic that's often in the shadows. If someone listening has recognized themselves or their partner in some of what we've discussed, what's the key takeaway, your main piece of advice?
The biggest thing is, please know you are not alone. This is common. And, perhaps even more importantly, help is available and treatment is often very successful.
So don't suffer in silence.
Exactly. Don't suffer in silence. Seeking support is a positive, proactive step towards improving your quality of life. My strongest advice: open up. Start the conversation.
With who?
With your partner, if you feel comfortable. With a trusted friend, perhaps. But most importantly, talk to a healthcare professional. Your primary care doctor is a good starting point. Or you could see a specialist like a urologist, a gynecologist, or find a certified sex therapist.
Get a proper diagnosis and discuss options.
Precisely. Get an accurate diagnosis, understand the potential causes, and learn about the treatment options available to you. Also, educate yourself from reliable sources. Knowledge is empowering. And maybe the hardest part, be patient. Be patient and compassionate with yourself and with your partner if they're involved. Treatment can take time, and there might be ups and downs.
That's really important advice. Patience and self-compassion.
Absolutely. Remember, your sexual health is a valid and important part of your overall health and well-being. Don't let embarrassment or shame prevent you from seeking the help and information you deserve. There really is hope, and there are solutions out there. Taking that first step, making the appointment, starting the conversation, that's the most crucial part.
That's such a powerful and hopeful note to end on. Thank you so much for clarifying all of this. It's a vital reminder that paying attention to all aspects of our health, including our sexual health, is just fundamental to living a full life. For everyone listening, if this resonated, remember that opening that door, starting that conversation, it really is the first step towards finding solutions and hopefully a healthier, happier you. Your sexual health matters.